taken to the ER, unable to let anyone examine him, so he was sedated. Once he was sedated, they were able to take his boot off and examine, and there was actually no damage to his foot at all. The nail had gone right through his toes. And so there was no tissue damage, yet he had horrific pain to the point where he needed to be sedated in order to control his pain.
Also, when we cross-reference these strength findings with range of motion, we can actually figure out, is the weakness due to the fact that the muscles are shortened, or are the muscles in a lengthened position?
Osteoarthritis, again, we talked about this a little bit, how it's more than just the bone-on-bone arthritis of what we talk about. It's the ligaments, it's the tendons, it's the musculature, but it's also the inflammation in the body.
So our sexual brain has both that accelerator, which responds to stimulation, and it has the sexual brakes, which responds to all the reasons not to be excited and in the mood. And that's sometimes the why. Why are we lacking? Because our brakes are so much stronger.
I can't tell you how many times, probably every single day, I have somebody tell me, yes, I used to have pain in my, my low back or my shoulder or my ankle or whatever it was. And then they got more and more and more pain, and it started to turn into widespread pain. And we're going to talk in just a few minutes about why that happens.
One of the sayings that stuck with me for a long time is the best exercise to do is the one you're going to do. And then the second best exercise to do is the one you're not doing.
When you send a patient to a dispensary, their options are a lot, actually. Obviously, you can just roll it and smoke it. Now, that's not great because you're inhaling toxins from smoking it, right? Try vaporizing it.
A lot of the patients are just getting better and not needing medications. I'm seeing that in my practice. And a lot of people assume if a doctor is doing PRP, it's a huge moneymaker. Well, yes and no.
What my patients who are on CBD oil tell me is that CBD oil has helped them become less anxious, can help them sleep better. And we know that anxiety and sleep issues are a big component of chronic pain.
And then that cartilage matrix fragility. That basically means that when we enter menopause, we are more likely to progress rapidly into osteoarthritis. It increases around that time, as does the pain.
These devices, different from what we've already talked about around laser, shockwave and EMTT, which can penetrate all different types of tissue. Neuromuscular activation devices are specifically focused on improving strength and neuromuscular control. This is an extremely important part of what often is leading to injuries.
So I'm an internist by training, but also an osteopath, and I serve with both Dr. Chin and Dr. Baltazar on the New York State Osteopathic Medical Society board.
A lot of the chronic painkillers out there are because the patients never got really treated in terms of their basic problem. I boiled down osteopathic medicine. The osteopathic technique says, if you have a sliding glass door off its track, does it work? It doesn't. If you put it back on the track, things can start to heal and get better and actually start working.
A very common thing that we're seeing, and we're writing a paper on this now, is that when somebody has a minor car crash and they're seat belted in, that causes compression of the thoracic outlet. That may not be a big deal in the moment, but when you have a joint that's not moving, imagine keeping your arm in a sling for 5 years. That is going to get more and more tight until it starts to impinge on your nerves, muscles, lymphatics, and that then produces a symptom that you then go to see your doctor about.